Hi everyone, I'm Sylvia, a breast cancer survivor and founder of Madeira. While going through cancer treatment, I spent hours researching and speaking to professionals about health topics, and I created this channel to share my insights with you. And in this video, we're all going to talk about aromatherapy. We're going to talk about what it is and 5 big benefits it can provide. My friend who just went through chemotherapy found it super helpful to be using essential oils for sleep. So we'll dive into its use as an additive therapy for cancer. And then I have some follow-on videos where we'll take a look at different types of essential oils and how to use them at home. If you think it's just about sniffing this bottle, well, there's more to it than that. We'll even have a special guest join us to talk about how to use aromatherapy candles. Candles like this one are included in Madeira's Mind Care box. So if you have a box, stick around to learn how to use these candles. All right, let's jump in. Over the last decade, aromatherapy has become trendy in many online wellness communities. A lot of people think it's this woo-woo food like pseudoscience, but there's actually a lot of research showing the potential health benefits of essential oils. The word aromatherapy is derived from 2 words: aroma, meaning smell and fragrance, and therapy, which obviously means the treatment. The name was coined back in the late 1940s when a prominent French chemist named René Maurice Gatlifours accidentally burned his hand and found that lavender essential oil helped with the healing process. This inspired him to research and ultimately publish a book called Aromatherapy, which highlighted the many benefits of essential oils. So what are essential oils exactly? Well, they're basically plant extracts. You steam or press various parts of a plant, the flowers, bark, leaves, or fruit, and capture the fragrance. It can take pounds of plant to make a small bottle like this one. And when you inhale the fragrance, the scent molecules travel from your olfactory nerves to your brain, and that's where it has an impact. So here are 5 big things that aromatherapy can do for you. 1, it can boost your mental health. Applying and inhaling essential oils have been shown to relieve stress, insomnia, and depression. In one study, researchers gave women going through labor rose oil and a warm foot bath, and those who got the treatment reported significantly less anxiety than those who didn't get it. In another study, lavender essential oil was found to reduce anxiety in patients with coronary heart disease. There are also other studies showing that combining aromatherapy with mind-body practices like meditation can help clear negative emotions, boost energy, and help reduce symptoms of mental disorders. Number 2, it can regulate your hormones. Many gynecology professionals recognize the advantages of aromatherapy for women, especially when applied to childbirth, as we were just talking about. In one study, 50% of mothers rated aromatherapy as helpful during childbirth. Other studies have shown that inhaling or diffusing peppermint essential oil can help manage hot flashes and symptoms of menopause, and that oils can help relieve nausea and discomfort that can come with a woman's period. Number 3, it can help with neurological disorders such as Alzheimer's and dementia. In a literature review, researchers summarized that essential oils possess neuroprotective anti-aging potential and are effective in helping combat the effects of dementia, epilepsy, anxiety, and other neurological disorders. Other studies have further found that aromatherapy with lemon balm oil is an effective treatment for clinically significant agitation in people with severe dementia, and that using thyme and bergamot essential oils can alleviate cognitive impairments. Number 4, it can help manage pain. A 2016 meta-analysis found a significant positive effect of aromatherapy in reducing and managing pain. The results indicated that aromatherapy should be included as a safe addition to current pain management techniques. The researchers even noted that aromatherapy is just cheaper than standard pain management, making it way more accessible. What's cool is that the positive pain management results have been shown in various essential oil uses, from cosmetics to massages and inhalation. There's even growing evidence that aromatherapy with curcumin, frankincense, and ginger can help with the management of chronic pain conditions like osteoporosis and rheumatoid arthritis. So now, knowing that, you can get a sense of how aromatherapy can possibly apply to cancer care. It's not that essential oils can cure cancer, but there is research that suggests aromatherapy can help improve quality of life and help alleviate symptoms like pain. Specific to that, here are some studies that I found, and as usual, all links to the research will be in the video description. First, there are studies that show essential oils can help with anxiety and depression in cancer patients. In a clinical trial, 103 cancer patients were given routine massages, with some participants getting aromatherapy massages with chamomile oil. This study concluded that the group with the oil noted decreased anxiety and improved symptoms, whereas the group without the oil didn't receive the same benefits. In another study, cancer patients completed 6 aromatherapy sessions and showed an improvement in mood, anxiety, and depression. There's even a study that shows aromatherapy can help with anxiety during breast biopsies, a procedure that I personally just hate. In the study, women getting breast biopsies were randomly assigned essential oil drops placed on a tab in their hospital gowns. The women who got the aromatherapy tabs had less treatment-related anxiety when compared to those who received the scentless tab. I really should be using this myself the next time I go for a biopsy instead of asking my doctor for Ativan. Now second, there's a study showing essential oils can help with sleep in cancer patients. In the study, newly diagnosed cancer patients who had just been admitted for chemotherapy inhaled an essential oil through a diffuser at night for 3 weeks. The results showed more peaceful sleep, better appetite, reduced anxiety, less drowsiness, and improved well-being. And like I said, I have a friend who found this super helpful during her treatment. Third, there's a study showing essential oils can help with nausea during chemo. In the study, women receiving chemotherapy treatment for breast cancer inhaled ginger essential oil and noticed a decrease in nausea. So now you know the benefits of aromatherapy. But a word of caution. If you go to the National Cancer Institute's website, they say that studies of aromatherapy have shown mixed results. Some studies, like the one I just quoted, showed an improvement to mood, anxiety, sleep, nausea, and pain. But other studies showed no change in symptoms. So as usual, I recommend you look at the data for yourself and also try aromatherapy yourself to see what can work for you. Now, there are many different types of scents and oils, each with their own benefits. So if you're interested in an introduction to the different types, tune into my next video. I'll also go through some do's and don'ts of doing aromatherapy at home. And if you like this video and want to learn more about other topics like sleep and art therapy, subscribe. Till next time, take care, friends.